Okay. Good morning, everybody. Welcome to Toolkit Tuesday with Sam Nigro. Sam Nigro is the Area Vice President of Small Business and Employee Benefit Consultant with Gallagher. Gallagher is a Fortune 500 organization and a global leader in insurance, risk management, and consulting services. Sam has been in the insurance industry for 26 years. Sam has expertise in both individual and group insurance. He also has an extensive background in ancillary lines such as dental, vision, short and long-term disability, life insurance, and long-term care. Sam lives in Omaha with his wife Erin and 2 children, Maya and Jack. Let's welcome Sam.
Well, good morning, everybody. I'm glad to be here. So just a little bit of background on me beyond just that bio. So like she said, I've been in this business 26 years. I was with a large agency for about 15 years, and then I had my own agency for 12, and then just recently here, or 11, and then just recently here, merged my agency into Gallagher, which is a Fortune 500 organization. And so pretty excited about where we are as far as being able to provide value and service to people. And I'm excited to be able to help Nebraska realtors in any way I can. I actually was a management and real estate major, and I take a little bit of heat because I'm in insurance and not real estate. But my dad sold real estate, so that's kind of been my part of where my heart is. So I just enjoy helping people. So as I go through this, if you've heard me talk before, some of this might sound familiar. I want to give you just kind of a bullet point list. I know it was put out in the promo of what I would be talking about, but I just want to give you kind of a heads up of what we're going to go over this morning. So, I tell people that, especially in the real estate world, your health insurance does not have to be equal to a house payment. It just doesn't. There are options out there. If you know where to look, there are options out there that can really be decent options for an individual or a family. And we'll go through some of those. I'm going to share my screen. I'll kind of show you kind of what some of those options look like. And I'm just kind of looking at my notes. We're going to go through understanding what your options are for buying health insurance. I think my industry, a lot of times, unfortunately, there's some great people in my industry, but I think my industry does a good job of making this way too complicated. And so I'm going to bring it down to what I think is a pretty simple way to think about what your options are for buying health insurance. I'm also going to talk about marketplace subsidies and some of the really important things that happened legislatively here recently. I'm on my association. I am the current state legislative chair, and so very connected to Washington and what's going on as far as healthcare and different legislation that has gone through. We're going to talk a little bit about the marketplaces. Again, I'm going to share my screen. I'll show you what that looks like. Also very excited. If you've followed individual health insurance at all, you know that for the last 5 years, Blue Cross Blue Shield has not sold individual Affordable Care Act compliant plans. They had a plan called Armor Health, but it wasn't really, there's a backstory to why they had that, and it wasn't really a great fit for a lot of people. But they are coming back January 1 to sell plans in Nebraska, and that's really exciting because, as I'll talk about in the marketplace, we have 4 carriers this year. They're all regional, 2 from Minnesota and 2 from the west or East Coast. And so it's going to be exciting to have a home team again as an option for us. And then lastly, I want to take a minute and talk about the new Nebraska Realtors Association dental plan that we're rolling out. This we're really excited about. And this is designed very specifically for realtors. So it's pretty unique in some of the way the benefits are for this, and in particular, the eligibility benefits for it. So I'll go through all those things. So that's what I'm going to talk about. And at any point, certainly as somebody always does when they do one of these talks, you can always just raise your hand if you got a question. I'll stop, and or we'll leave some time at the end. I don't know if we'll take the full hour, but we'll leave some time at the end to open it up for questions. So with that, let me start with what your options are for buying health insurance, because I think as consumers, it's really easy to get really confused with this, and it really doesn't have to be. So in a silly analogy, if you think of buying health insurance like anything we would buy in a store. So imagine we're going to go into this store and we're going to buy health insurance. Well, in Nebraska, we only have, as realtors, you only have 4 aisles. Most people only have 3, but you'll have 4 aisles that you can shop in. The first aisle is a employer plan. So if you have access to an employer plan, either through your work or through a spouse's work, you can shop in aisle 1. Aisle 2 is what I call full coverage plans. Those are the plans that cover all pre-existing conditions. They don't ask health questions to get in. Preventative is free. There's no lifetime limits. So those are the full coverage plans. I'm going to come back to aisle 2 in a second. Aisle 3 is what I call non-traditional plans. A non-traditional plan is, for the right person, can be 60% lower cost than aisle 1 or aisle 2. But the downside to the aisle 3 plans, the non-traditional plans, is that those plans don't cover pre-existing, they don't cover maternity, they don't cover mental health, and they have limited preventative and prescription. But for the right person who says, gosh, none of that is really relevant to me, I just want good major medical, and I don't want to pay an arm and a leg for it, those aisle 3 plans can be a good option. And then aisle 4 is the Realtors Association plan. And we put a plan in a couple of years back. It was very niche. It didn't necessarily pan out to be quite as effective as we had hoped. But we're on kind of the track here to roll out something new for January 1. We haven't fine-tuned all of the specifics of it, but just to kind of tell you, more is coming on that. And as soon as it does, I'll announce it, that what we're going to put in place there. But we're pretty excited. It's a program that has been done in associations all over the country and with a lot of success. So that would be aisle 4. So those are the 4 aisles. Let me go back to aisle 2 for a second, which is the full coverage aisle. I think this is where a lot of us get confused with what we see on TV and hear on the radio. So we're in this imaginary store, and we're going to shop in aisle 2 for whatever reason. Let's say you've got some health history and you say, yep, I need the pre-existing conditions covered. So we go down aisle 2, we pick out whatever plan you want, and then you take it to one of 2 registers to pay for it. You either take it to the insurance company register and pay full price, or if you qualify based on certain criteria, you can take it through the marketplace register. There's some people call it healthcare.gov or Obamacare, whatever they want to call it. It doesn't matter. It's just a website. It's just a register in the store, so to speak, where I can take that plan from aisle 2, go through their register, and I've got a back door as a broker, and that's what I'm going to show you is how it looks on the back door. And then you as consumers can go in through the front door, and the government will say, well, we'll help you pay for that policy. And that's really where the marketplace comes in. I think understanding that marketplace and those subsidies is really important, especially as realtors. This is the most common response. When I say marketplace, this is the most common response I get from a realtor. Yeah, I don't qualify. I make too much money. And then when I show them what it looks like, because I'm going to talk about this a little bit, they go, really? I didn't know that was the case. So in the American Rescue Plan in March of 2021, prior to that, what the government did was they said, well, there's going to be an income threshold. So like, for example, if there were 2 people in the household, the income threshold was 67,000 and some change. So if you had an adjusted gross income, and this is really key, especially as a business owner, if you have an adjusted gross income, so after your business expenses, what you're personally taxed on, of greater than 67,000, you couldn't get any help from the marketplace. And that's why people would go, yeah, I can't, I looked at that before. Well, in March, through the American Rescue Plan, they took the dollar income ceiling away. And they said, we're going to change this over to a percentage so that nobody pays more than 8.5% of their income. And that is a game changer for a lot of people. I'll give you an example. I've got a couple that they're in their early 60s and they both had health history. So from January through May, or January through April, because it actually enacted May 1st, in January through April of 2021, they were paying $1,800 a month for their health insurance. Yeah, I know. You're shaking your head. It's crazy, right? It's a house payment. After the American Rescue Plan, because they made 80,000, so they were over the 67, so they couldn't get any help. After the American Rescue Plan, we went back in and we readjusted based on the change, and their premium literally went to zero. It went from $1,800 a month to nothing. And I tell you, I've done this a long time. When I was talking to him, the guy almost cried on the phone. Like, this was so impactful for him. And then, of course, as the good American he is, he says, I think I'll buy a boat. And I said, no, don't buy a boat. Just save the money. But it was a huge impact. And I'm going to show you what that impact looks like. The most common question, I don't know how many people this would apply to, but I think one of the most common, not questions, but one of the most common scenarios I get in the environment that we're in as far as demographically is the spouse, the husband and wife, where one is really close to Medicare and the other one still has a few years to go. And they're trying to figure out what to do. Or the person who says, well, or myself or whatever, I'd like to step away from what I'm doing. Maybe I'd like to own my own business, or maybe I don't want my wife to work outside the home, but we need that health insurance. This is really where the marketplace can be a real value for people. So before I share my screen, I guess what I want to ask is there any questions before I get into showing you what the marketplace looks like? Okay. All right, so let me go in. Let's go, let me find the wonderful world of multiple screens. Let me find the right screen here. Okay, so I'm going to show you two examples of coverage. One of the things, and you can access my backdoor, you don't have to go into healthcare.gov if you don't want to. One of the things, and I guess this would be the sales pitch for me, maybe you already have a marketplace plan. It does not cost you any more to have a broker involved. So if you want somebody as an advocate, if something happens, you get a bill you don't understand, or you lose your ID card, the cost to you for a marketplace plan is the same, whether you go to healthcare.gov yourself or I help you. So if you have a marketplace plan, you say, well, gosh, I wouldn't mind having somebody help me. We can certainly do that. But here's an example of somebody who is in Lincoln. Husband is 60, wife is 57. And between the two of them, their adjusted gross income is 150,000. At 150,000, based upon those ages, the government would say, go down aisle 2, pick out whatever plan you want. Let me see if I can make this just so go down aisle 2, pick out whatever plan you want, and we will pay up to $929 a month of that plan. So what that means to that couple is that they can pick the lowest cost plan. This is 2022. The 2023, the January ones, will be open enrollment starts November 1. We should be able to quote towards the end of October coming up here, but we can't do anything until November 1. But this would mean for this couple that they could get, if they were just looking, now this is a high deductible plan, it may not be what they want to do, but they could get a plan that would be $542.58 for both of them. That's not per person. And so you can look at this and say, okay, well, there's obviously 95 plans in there. That's a lot of plans. But I want to show you in in this year, the plan that was really the most impactful, because this is going to kind of dovetail into the conversation about Blue Cross and then also Medica. Let me back up here a second. So in Nebraska right now in 2022, we've got 4 carriers. We've got Ambetter, Bright Health, who's out of Minneapolis, Medica, who's out of Minneapolis, and Oscar. These 2 are primarily market internet-based kind of carriers. They're regional, but you may have heard Bright Health. They grew too fast. they way too fast, and they couldn't handle the growth really. So they're actually not going to sell in Nebraska in 2023. So if you have a Bright Health plan, you want to make sure you're talking to somebody, because you're going to have to switch that plan over to another carrier, or the marketplace is going to do it for you, and you don't want them to do it because they'll just pick a plan. But next year, in place of Bright Health, we'll have Blue Cross. So we'll still have Ambetter, we'll have Medica, and we'll have Oscar. But I want to show you the plan that Bright Health had that was incredibly popular. This plan for this particular couple, it would be $699 for both of them. So that's 2 people. That's, you know, $350 a month per person. And the plan has no deductible. It's literally just copays from top to bottom. There are a couple situations where you would pay a co-insurance percentage, but for the most part, you just pay a copay if you want to see a doctor. You pay a copay if you want to see a specialist. You have a copay if you want to have an MRI done. You have a copay if you go in for a procedure. And all those copays go towards the max out of pocket. And once a person hits that max out of pocket, then they're done for the calendar year, and the insurance pays 100% after that. So that was a very popular plan. And based on that subsidy, that's what it would look like. So I want to show you another example, because that's just kind of one demographic. And Christy, I'm going to ask you, because I'm not really looking at the chat, in case if there's any questions, we'll get to those at the end. But if there are questions in the chat, if you can just keep an eye on that.
Okay.
So,
can you hear me?
Yep.
Okay.
So here's the other example. So this would be a couple where he's 40, they're both 45, and let's say they have 3 kids, 15, 10, and 8. And Lord help them, they're all girls, right? I have one daughter, she's 19, and my son is 16. I have friends that have 3 girls, and I just, God bless them. That's a lot. But let's say they make 100 grand, and that's their adjusted gross income. So that's after their business expenses. The government would say, in that family of 5, pick out whatever plan in aisle 2 you want, and we will pay up to $1,700 a month of that plan. So the plans are going to be different because it's in a different zip code. I used Omaha as a zip code here, just as an example. But in these plans, there's 102, and I want you to just look at the premiums on this as we look at this. We're not going to focus so much on this stuff at this point, but I just want you to look at the opportunity they have to get coverage. There's 10 plans per screen. The first look like 5 were free, and then $2 and $2. This is for the whole family, for all 5 people. If you were to scroll down and say, okay, well, realistically, you know, what do we have for options? If we go to the top 40 plans, that family of 5 they would have 40 choices that come down to basically $100 a month per person. That's pretty impactful. And again, that's the advantage of these subsidies. Now I want to, before I change gears on this and talk about the Blue Cross Blue Shield coming in, I want to talk a little bit about what you may have heard here recently as far as legislation. So I said it was a game changer for a lot of people when they changed that income cap to a percentage. Well, that was expected to sunset at the end of this year. But in the Inflation Reduction Act that was recently passed, they extended that through 2025. So this generous subsidy, now this is, let's hold aside our, any, political views we might have on, okay, where are they going to get all the money to pay for this? That's a whole different conversation. Because I, as a broker, I work for you. I don't work for the insurance companies. I can tell you very transparently, this is a broken system, but it is the system we have to operate with it. And so we just operate within it. But these subsidies are going to be available for through 2025. So that could be pretty substantial for a lot of people. So I wanted to give you a feel for that. Now I'm going to give you, and Christy can send it out. So my website for this, if you said, well, I want to go in and look at this, my website for this is 5minuteinsurance.net. Okay. In fact, I'll just. Come on, fingers. There we go. Sometimes it does this where it says this isn't working and then you have to refresh it. I don't know why I have to talk to my web people because you click on the refresh and it'll come back up. So this is my site. If you go to this site, you're not going to get calls. Your phone's not going to ring off the hook from Florida and Texas. That anybody who has Googled health insurance knows exactly what I'm talking about. You'll get like 100 calls in one day. None of them are from Nebraska. But and it'll ask you to put some information in, and again, that just is my information. But you can go here, and you can submit to me, and I'll reach out to you, or you can go in and just start shopping, and you can take a look. Like I said, at the end of October is when 2023 will go live, and then November 1 is when we can start doing enrollments for January 1st. Enough of what appears to maybe be a sales pitch. I'm not intending it to be necessarily. I just want to make sure you have the resources you have. So let's talk about the Blue Cross Blue Shield. Again, like I said before, we're excited that we're going to have a home team. And one of the advantages, one of the benefits we did have in the 1 year that we had Bright Health is they kind of set the standard. They kind of set an expectation for what Nebraska consumers really want in their health coverage. And Blue Cross listened to this. Medica did also. Medica's got some really good plans coming up here for 2022 or 2023. But Blue Cross does as well. So I'm just going to give you kind of a quick overview. And if you're not familiar with the marketplace, I'm going to kind of give you using the Blue Cross, I'm going to give you a couple things to think about. So let me go past these pages here. So early in their brochure, and I can get this brochure to you, it's not, it's public knowledge. So early in their brochure, they'll say, number one is review networks. This is really, really important. When we go back to the store, aisle 1, for the most part, you'll have national networks. Aisle 3, you'll have national networks. Aisle 4, we're going to have national networks. Aisle 2 are state-based networks only. What that means is that you have to pick the network you want within that state. And there's sometimes crossover, we go over to Council Bluffs or whatever, but you have to pick the network you want within that state. And if you go outside that network, you have no coverage in aisle 2, other than emergencies, which are by law covered as in network. But if you were in Colorado and just not feeling well and you wanted to go to an urgent care and you have an aisle 2 plan, you have no coverage. And that's important to note, because I do get a lot of people that, especially in that first demographic, where they say, well, gosh, I live 3 months in Nebraska and, I live 9 months in Nebraska and 3 months, somewhere else. So making sure you understand networks are very important. The other thing that Blue Cross is going to do that is very common, Medica does the same, Medica, Ambetter, Oscar, they all do the same thing, is they have what they call dedicated networks. So they have, in Nebraska, they've got their Network Blue, which is more expensive, but you're basically getting the full state network. And then they will have dedicated networks that are lower cost. The Premier Select is under the umbrella of what's essentially considered the Nebraska Health Network. And you can see the the different plans that are or the different hospitals that are in network there. And then they've got Blueprint, which is essentially your CHI providers. And so again, you want to be careful with this when you do go into the marketplace, that you're making sure, number one, that you're checking your doctors that they're in the plan you're in, because once you pick a plan, that's your plan. And outside of open enrollment, it's not easy to change. It's not possible to change that unless you have a qualifying event. Blue Cross is going to have bronze, silver, and gold plans. They've got 10 bronze plans. They have 4 silver plans and 3 gold plans. I'm not going to go through all of these plans. I'm sure me going through every one of these plans and every row on these plans would be right up there with a root canal or chewing broken glass. So I won't do that. I won't put you through that. Let's call it what it is, right? But they do have some good options. One of the things that you'll see fairly commonly in the marketplace, it's another thing to be aware of, is the out-of-pocket maximums. And you'll see that as opposed to aisle 1 in particular, a group plan, out-of-pocket maximums in the marketplace tend to be fairly high. You can get low deductibles. These are the bronze plans, but the out-of-pocket maximums tend to be fairly high. And so we just need to factor that in. I would say, though, realistically, I think as consumers, this is less to be afraid of than historically it was. And there's some reasons why I don't have time to go into them today, but I think more commonly what people are more interested in is what's the deductible, what's my care underneath that, as far as going to a physician or a specialist or whatever it might be. And you can kind of see just by the terminology in here that they've got a mix. They've got some plans that have flat copays, and then they've got some plans where it goes to deductible. They do have some HSA eligible plans that they're going to have. The silver, I think, is interesting because the silver is where they're going to have that plan that's very similar to that Bright Health plan. It doesn't have the copays, but you only pay a percentage. You don't have a deductible. So there's no large upfront amount you have to meet. You just pay a percentage, 40%, or I'm sorry, 60% of what your services are, up to the maximum out of pocket. And then again, once you hit the maximum out of pocket, then it's covered 100%. Backing up real quick, and I'm sure most everybody on this understands terminology of deductibles and coinsurance and copays. I do want to take one quick minute and try and simplify that for you, because people do get confused by it. Any health insurance plan you would ever buy, doesn't matter whether it's marketplace, aisle 1, aisle 2, aisle 3, it doesn't make any difference. Any health insurance plan you'd ever buy has 3 parts to it, potentially, and they work chronologically. Step 1 is a copay. Step 2 is the deductible, which would be this here. And step 3 is the coinsurance, which is the percentage you pay until you hit the maximum out of pocket. Easiest way to understand deductible and out of pocket maximum is not from our perspective. It's looking at it from the carrier's perspective. As much as we'd love to believe the insurance companies are these noble organizations that are, exclusively trying to do the right by everybody, and they are to a certain degree trying to do right money. And so the deductible terminology and the out-of-pocket maximum terminology isn't for us, it's for them. They want to know, with the deductible, when are they supposed to start paying something? And then the maximum out of pocket tells them when are they supposed to start paying 100%. That's the symbol of a deductible and a max out of pocket. And then they will have some gold. We'll have some gold plans as well in the Blue Cross. And so they'll have a mix in there of plans. And we'll just see, we don't have the pricing yet. All the carriers have to file their rates with the state of Nebraska. There is the store is the store. There's no bidding. There's no broker gets any different rates. I don't have any special rates over anybody else. We're all shopping in the same store. And so once they publish them, and those are the rates for the calendar year. Any questions on this before I move on to the dental plan? And we're only half an hour in. We've got it slotted for an hour, but Certainly want to be able to field any questions relative to what I've talked to or any questions in general on health insurance before I move over to the new Nebraska Realtors dental plan.
So Sam, I have a question. What if you have a pre-existing condition?
Yeah, so if you have, that's a good question. If you have pre-existing conditions, you really want to hang out in aisle 1, an employer plan, if you can get it, aisle 2, the full coverage plans, or in the Realtors Association plan, aisle 3, or I'm sorry, aisle 4, because in those aisles in particular, like even with this aisle 2, they cannot ask any health questions to get in. It's guarantee issue, and they have to, if it's a coverable expense, they have to cover that pre-existing condition. Aisle 3 is the one where the premium drops significantly because they don't have to cover that pre-existing condition in every situation. And some carriers, they don't cover it for the first year, and then they cover it after that. Some carriers, they don't cover it at all. But aisle 1, aisle 2, and aisle 4 for realtors, they'll be guarantee issue where pre-existing conditions are covered.
Thank you.
Any other questions on health coverage in general or anything that I've talked about related to the health insurance? Okay, we'll keep moving right along, and if I get to give you back some of your day, that's okay too. So let me go make this a little bit bigger. So we are excited to roll out the Delta Dental plan for, it's called the Pathfinder plan. This is specific for the Nebraska Realtors Association. And when I put this together with Delta, there were a couple things that I wanted to make sure that they had in there. And so I'm going to write to this page here where it shows the cost. You can see that it's a relatively low dental cost. It's $29.97 if you're a subscriber.
Sam, we're still seeing the old screen, I think.
Oh, okay. Sorry, I didn't. Let me change it. Share screen. Thank you. Sorry about that.
No, you're welcome.
There we go. Okay.
There we go.
Good. Okay. So this is the Delta Dental Pathfinder 6 plan that we put together for the association. You can see that the subscriber rate is $29.97. You can see the subscriber plus spouse and the children and the family rate. Here's my feeling on dental. I think it's a great opportunity to say, you know, if what I'm looking for is just to have my cleanings and x-rays covered, then these plans, even this one or any other, you'll probably basically break even in comparison to what you would if you paid cash. So if you were going to just go to the dentist and say, hey, I'm going to pay cash and I just want to get a friends and family discount, you know, if all you wanted was preventative, you know, that might actually be a better way to go than doing a dental plan. But if you said, no, I do want some protection, I want a bucket of the insurance company's money to use if we have a cavity or a crown or, you know, something happens. One of the things that's unique about this and specific to the realtors, so these are all going to be set up as group plans. So it's not that the Realtor Association is one big plan. It's under the context of being a member of the association. You can set up your own group plan, but here's the catch. You only need 2, and they will allow husband and wife to be the 2. So if you're a realtor and it's just your family and you don't have any staff or anything, you can do 2 subscribers to set up your 2. So it's a really nice avenue, and we don't have to demonstrate W-2. Doesn't matter if they're 1099. None of that matters in the way that we've set this up. So that's a real big advantage for the realtors. If you do have staff, you could certainly expand this out to your staff as well, whether they're part-time or full-time, it doesn't matter. So if you said, gosh, I really got this great person working for me, or these couple people, and you know, I don't do a lot in the way of benefits, but I like to do something for them, this is a great way to say, hey, you know, you're important to me, and I want to help you in at least this way, you know, as much as I can. And then as far as the plan specifics, pretty straightforward in terms of the plan. So you get on the preventative services, you get 2 cleanings and an x-ray covered 100%, covers basic services at 80%. And there's a couple where it's 55%, but for the most part, it's 80%. And then the major services is at 55%. It does have ortho for children in it, which is nice in that. And this is one of the really important parts of this plan is it has a lifetime deductible. And once you meet it, you're done. So it's $100 deductible. And once you meet that deductible, you never have to pay the deductible again. And then the annual maximum is $1,000 per person on the plan. So it's a pretty good plan. We're pretty excited about it. And this could be effective 11/1 is when we're rolling this out. So feel free to reach out to me if you have any questions on this or it's something you have more interest in. We can certainly go over that. So with that, we're at 10:36. I don't want to take any more of your time than necessary, but I certainly want to give you the opportunity to ask any questions if you have any.
Anybody have any questions? Mary says no.
Okay.
Chad Beeman, how about you? Do you have any questions? He's not even going to answer.
Nothing. I don't have any, no.
Okay.
Well, that's no problem. And you can get a hold of me if you do have any questions. One of the commitments that I have to the association is I'm not here just to push products or sell stuff. I mean, I've been doing this a long time and I really appreciate the association. So if you just need some advice on something, if you have somebody showing you something and you want to call me and say, hey, I'm not looking to, to get any proposals or anything or any quotes from you or anything. What do you think of this? Or what do you think of my husband's employer has 2 plans. Which plan should we choose? That's part of my commitment to the association is to just be here as a consultant to help anybody with their insurance. And it may not just be your health insurance, it might be dental, vision, life insurance, whatever it might be. I've been doing this a long time and I'm happy to put a set of eyes on something if you need it. So.
Sam,
This
do
is
you
just
have
a
an
little-
example of what an application looks like? What information they are required to give on an application?
Which type of application? Are you talking about the health insurance?
Yes.
Through the marketplace or
Well,
otherwise?
Otherwise.
Okay, so all they ask is on the aisle 3, they ask questions that are going to be your standard. Have you ever had, and they're going to go through the heart and blood and all, those different. They're not going to. There's no nurse or anything, but they're going to ask you all the health history questions: diabetes, cancer, heart, stroke, those type of things on the aisle 3 plans. And all you do with those aisle 3 plans in that world is really simple because in that world, it's like add to cart kind of a world. So I send a link out and you add to cart, you check out, you put your information in, you answer their health history questions, you put in your payment information, and then they take about 48 hours to review it. But really what they're doing is they're looking back for the most part. I mean, they do have some of the big stuff, the cancer, the heart attacks, the strokes, that they'll go back, looking back, 5 years maybe or more. But in general, they're just looking back 24 months as far as what a person has. So the biggest one, though, is prescriptions. That's the one that trips people up in aisle 3 if they're not able to get an aisle 3 plan, because I mean, we talk about the cost of health insurance. It's a big, culprit. There's a lot of culprits, but a big culprit of that is the pharmacy side. Excuse me, the pharmacy side, because prescriptions are so expensive.
Sure.
I don't know if I answered your question as directly as I could, but
You did.
okay. With the others, the application is really easy. There's no health questions. So it's, like a marketplace application, I can do that in less than 10 minutes. And all I do is just ask the questions over the phone, and they're pretty simple. So.
So I have one last thing to say. This is a testimonial on behalf of Sam. One of our Realtor staff people has been working with Sam with her health insurance, and she says he's phenomenal. He bends over backwards to help them out, and they really appreciate that. So thank you, Sam.
Yeah, thank you. I appreciate that. Those kind words. So.
Anybody
Right.
else?
Well, you get an extra 20 minutes today. Thanks for taking the time. I know you're busy, you got stuff to do, and especially when it's wrap up season for a lot of you. But happy selling out there. And if you need anything, I'm here to help at any point.
Thank you, Sam.
Mm-hmm.
And if there's any information you want me to send out, just email it to me and I'm more than happy to get it to him. Okay.
Sounds good. I will send some
Alrighty.
stuff over.
Yep.
Okay.
Okay. Thanks again. Everybody have a good day. Bye-bye.